Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to our live health show, Your Health, alhamdulillah. It's a pleasure to be here. May Allah Ta'ala help us say things which benefit you and I, inshallah ta'ala. Welcome back. Before the break, we were going through a list of 10 diseases which between them contributed to 50, or which between them caused 55.4 million deaths in 2015. 10 major illnesses. At the top of the list was heart disease, and then it was stroke. Ya Allah. And then then we come to infectious illnesses, and then COPD, and the list continues. And I mentioned what you could do to prevent your risk of dying or suffering the consequences of the first one, a biggest one, which contributed 15.5% of these 55.4 million people who died in 2015. And I mentioned, if you want to make sure your risk of dying from heart attacks and strokes plummets by 68% if you're a male, then you need to follow the sunnah of Rasulullah sallallahu alaihi wasallam and have a nap every day after lunch, 15-20 minutes, even if it's going to your car, if you're working and laying down for 10-20 minutes. You don't have to fall asleep. Just the fact that you're laying down, that will benefit you tremendously. If you can't do this every day, 3 times a week, if not 3 times a week, even once a week, 42% decrease of dying from a heart attack or stroke. Subhanallah. What else can you say but subhanallah when you know this is a sunnah of Rasul Kareem sallallahu alaihi wasallam? And I like to mention that many people, say, oh, it's a sunnah of Rasulullah. My friends, sunnah of Rasulullah is everything to us. Sunnah is everything to us. The Sahaba Kiram, they achieved glory by doing something because it was a sunnah. And we are achieving our state that we can see in front of us because we neglect a sunnah, because it's a sunnah, right? It's not farz or wajib, it's a sunnah. We need a radical shift. We've got a call waiting. Assalamu alaikum wa rahmatullahi wa barakatuh. Oops, I think we just lost them. Okay, so back to the 10 major killers in the Western world. Number 1 was heart disease. Let's go to the second one. Second one is stroke. Stroke means when the arteries or even the veins or capillaries are full of sludge called cholesterol, fatty substances, or homocysteine, and they make the whole, the blood, the venous supply so tight that they can rupture. So when they rupture and there's a leak on the brain, that's called a stroke. Or even when they are so full of this fatty substance that the blood can't reach its destination, this causes complications it's a stroke, and it will cause complications. Now, that fact I gave you, 55.4 million people dying in 2015, I mentioned before the heart disease caused 15.5% of that, which is about 8 million. The strokes contributed 6.2 million deaths in 2015, and the percentage is 11.1%. So 11.1% of people who died in 2015 from these 55.4 million, 11.1%, which kind of translates to 6.2 million, died of strokes. Now, stroke is a complication of heart disease. So the same thing applies to, to preventing stroke, which applies to preventing heart disease. And the biggest thing there, and this is no pill that can give you this benefit, no injection, is the simple siesta or qaylula, which is a sunnah of Rasul Kareem sallallahu alaihi wasallam. So 8.8 million people 2015 died of heart disease, and that was 15.5%. Stroke, as I mentioned to you, was 11.1%, and that translates to roughly, as I mentioned, 6.2 million people. Now let's talk about a stroke. When you have a stroke, God save everybody, Allah Ta'ala save everybody, you feel numbness in a certain part of your brain. When you feel this numbness, you have confusion, you have difficult walking. There's a list called, SMILE, which tells you, it's an acronym for the symptoms of a stroke. You're slurring, one of your lips can droop, the side of your mouth droops, you have confusion, facial paralysis can occur. So if you see these symptoms, you need to call the emergency or get yourself to the emergency department ASAP, within 15 minutes at the latest, 15 minutes. As I mentioned before, strokes are the leading cause of long-term disabilities. Stroke is the leading cause of long-term disability, and people who receive treatment within 3 hours, then alhamdulillah their prognosis is a lot better and their disabilities are a lot less. So it's good to know the signs of a stroke. So confusion, your lip dropping on one side, these are all signs of having a stroke. Any kind of confusion, any numbness you feel, that can be also a sign of a stroke. Now, again, what are the risk factors of having a stroke? Number one, high blood pressure. If you've got high blood pressure, again, your venous supply is under a lot of pressure. You need to take steps to remedy that. Number two, family history of stroke. If someone's had a stroke in your family, then you're more likely to have a stroke just by genetics. Number three, smoking. Smoking is dangerous. When we come to the when we talk about tracheal and bronchi and lung cancer, most guys who get it are people who smoke. Very, very dangerous. So smoking, very dangerous, especially if someone's combined them with oral contraceptives, a danger, danger, danger. And number four, females. Females are more at risk of having stroke. Okay. So again, preventatives, exercise, your medication that you're taking, keeping a low sodium diet, fruit and vegetable, being active, keeping your weight under control. But the biggest thing I mentioned to you was having kailula, having a nap, olive oil and intermittent fasting. Amazing things, all sunnah of Rasul Kareem Sallallahu Alaihi Wasallam. Having kailula, having olive oil, pure olive oil, the best you can buy. If people start having olive oil, subhanallah, their risks of heart disease will plummet, as is the case in these Mediterranean countries. And then having a nap, olive oil, and the third thing is making sure. Yeah, please do. Let's just put this. We're going to talk about the symptoms of stroke before we go to the. There we are. So we've got stroke. When stroke strikes, act fast. FAST. F for face, paralysis. A for arms. Your arms, when you put your arms up, one will fall down. Okay. And number three, speech. Speech will be kind of slurred. And then the fourth, most important thing is time. You need to act fast. Call the A&E, get yourself, or ask someone to take you to the emergency department. And the sooner you get there, the better your prognosis. Remember this, FAST, face, any kind of, when you smile, as you can see from this lady, her left side of her lip is drooping, that's a sign. Arms, when you hold them up, one will fall down. And number three, speech is slurred. And then another thing is, you'll be confused, you'll complain of numbness. And then the fourth, which is time, make sure you get to your A&E department ASAP. May Allah keep us safe. So I was mentioning three things for stroke which apply to heart disease and also apply to stroke. Number one was having a nap every single day, 20 minutes, 15 minutes, even if it's in the car park, in your car. Number one. Number two, having olive oil, the best you can get. The best olive oil, Moroccan olive oil is amazing. Do your research, and if you can't have it in your food, drink it morning and evening. It'll do so much. Let your GP know, mashallah. GPs are overworked, overburdened, I dare say underpaid, mashallah. That's what we get from our staff. And, if you bring this to their attention, it'll only benefit you, inshallah. So, sleeping, yani kailula, olive oil, and number three, intermittent fasting, Monday, Thursday. It's an amazing, amazing thing. Sunnah of Rasul Kareem Sallallahu Alaihi Wasallam. Dr. Michael Mosley has mentioned this, the kind of so-called inventor of the 5-2 diet. Of course, the real inventor was Nabi Kareem Sallallahu Alaihi Wasallam. We know this. Michael Mosley, Dr. Michael Mosley, esteemed physician. He's done his research. He's proved it with double-blind trials and so much more. Scientifically, the benefits of intermittent fasting. He says, the way Dr. Stephen Gundry says, olive oil is the single best thing for your heart health. Yeah. Dr. Michael Mosley says it's intermittent fasting, Monday and Thursday. And if you can't do Monday, Thursday weekly, then 3 days a month. And what did Rasul Kareem Sallallahu Alaihi Wasallam say? 13, 14, 15. Rasul Kareem Sallallahu would always do this. Nabi Kareem Sallallahu would fast on the Ayami Beed, the 13th, the 14th, the 15th of every lunar month. So Rasul Kareem Sallallahu was doing exactly what this Dr. Michael Mosley has told us. Fasting Monday, Thursday. Monday, why? Because Rasul Kareem Sallallahu was born on Monday, subhanallah. And Thursday, because on Thursday a person's amala given to Allah. And Rasul Kareem Sallallahu loved to be fasting in these days. And more than that, it's a sunnat of Rasul Kareem Sallallahu. We've got a call waiting. Let's go to the call. Assalamu alaikum.
Walaikum.
Ji bhai. How can we help?
Yeah, I'm just calling to ask you if you've got any advice on twitching.
Twitching?
Yeah.
Jazakallah. Keep listening, please, inshallah. Well, twitching where? On your... twitching where?
Different parts of my body.
Okay, fine. No problem at all. Jazakallah. Keep listening. Acha. This brother called and he said he has twitching. Twitching is a neurological symptom. Your eyes sometimes twitch, your eyebrows twitch, your eyelashes can twitch, and sometimes you have your, So if it's neurological, it's to do with the nerves. So if you're sleeping late, you're working hard, you're not exercising, your nutrition is really low, then you'll have these symptoms. One of the best things you can take for twitching across the board is magnesium citrate. Magnesium is actually the second most deficient mineral we have in our bodies after vitamin D. So magnesium is so good for twitching and so much more things. So if you have got issues with twitching, magnesium. Number two, what I suggest you add to this magnesium, and powder is best by the way, magnesium. What you can add to magnesium is B vitamins. B vitamins are so good for the nervous system, especially for our sisters. Every lady should take B vitamins. B50 complex is phenomenally good for so many things, especially for the nerves. Remember we mentioned that stroke is more common in ladies. There's a reason for that. So if you have issue with twitching or even cramps, magnesium is number one. Number two, a B50 complex is very good. And the third thing you can take is something called Avena sativa. That's the Latin name, Avena sativa. And in common English, it's the common oat. So porridge? Porridge is so good for fortifying the body and getting rid of twitches and giving you strength. In our clinic, we normally give Avena sativa in tincture form for people who have shaky hands. It's very good. So number one, magnesium citrate. Number two, B50 complex. Number three, Avena sativa. This will be of benefit to you, inshallah. But as always, let your GP know. It's his job. Any concerns, go and pack it with your GP. Let him do the test, inshallah, your full blood test, and see what he gives you. But inshallah, this will benefit you, what I mentioned. So let's move on. 55.4 million people died in 2015. That's a lot of people. 15.5% of these, 8.1 million, was because of heart disease. Number two, 6.1 million was because of strokes, which was, as I mentioned, the percentage was 11.1%. So stroke was 11.1% of these 55.4 million people. The third thing, lower respiratory infections. You have lower respiratory tract infection and upper respiratory tract infection. You've got your ear, your throat, your nose, they're upper respiratory tract infections. Lower respiratory tract infections are things like influenza, the flu, bronchitis, pneumonia, and other, like TB, for instance. These are all lower respiratory tract infections. So 3.2 million people from that 55.4 million people who died, 3.2 million died because of lower respiratory tract infections. So how many was that? 3.2 million people. What can you do for lower tract respiratory infections? We just come from COVID-19. Very dangerous. So normally these lower respiratory tract infections are viral. So there's nothing you can really, from the doctors, you could, okay, Jazakallah. So as I was saying, when you have the, what you can do to prevent these lower respiratory tract infections, obviously the viral, so plenty of rest, good health, wash your hands, vitamin C's, zincs, these things that, just and having a good rest help fortify your body and fight these viruses. Of course, antibiotics are no good, but sometimes these can be bacterial infections, like I mentioned, TB. Another issue is the reason why we can get these illnesses like bronchitis and even COPD is the quality of air that we are living amongst. It's so crazy, and then some people still use coal and certain wood burners. But the biggest thing is the quality of air. It's so dangerous, so dangerous. The air we're breathing in, I mentioned before another episode, the risk of asthma and how much it's increased for inner city children is phenomenal, and it's directly due to the contaminants from fuel. So number 3, the flu. What causes it? Poor air quality, smoking, weak immune system, asthma, and illnesses like HIV. These are very dangerous. I just want to quickly mention the 3 things which we mentioned for the caller who called in for twitches. The first thing was magnesium citrate. The second thing was B50 complex. And the third thing was alfalfa or Avena sativa, which is basically porridge, or the active ingredient in porridge. The 4th biggest cause of death from the 55.4 million people in 2015 is COPD, chronic obstructive pulmonary disease, which is a slow-acting progressive lung disease. Very, very dangerous. 3.1 million people died in 2015, which is 5.6% of the 55.4 million figure I mentioned. In America, for instance, in the year 2018, 16.4 million people got diagnosed with COPD, chronic obstructive pulmonary disease, a progressive disease of the lungs where you can't breathe, you find it difficult to breathe. One of the main reasons you get COPD is second-hand smoke or primary smoke. Very dangerous. If anyone's smoking, they need to stop right now. So lung irritants such as chemical fumes, if you're working in the chemical industry, be very careful. I knew a patient who died of pulmonary emphysema actually, and because he was working in a chemical environment, and that just destroyed his lungs. Pulmonary sarcoidosis he had. So lung irritants, dangerous. History of respiratory tract infection. If you've had a child who's always been ill with upper or lower respiratory tract infections, his risk of getting COPD goes, it escalates through the roof. So lung irritants, smoking or second-hand smoke, history of respiratory tract infections, or family history increases your risk of this. Again, COPD, there's no cure for COPD in the Western medical paradigm. Homeopathic medicine can do so much for you as it can do for many, many things. As I mentioned before, the Queen has homeopathic medicine. Why should you? Well, the Queen did have homeopathic medicine. Now her son has it. Why should you? Why should you refrain? You can benefit as well. The 5th major cause of death, the 10 major illnesses worldwide that cause death on a huge scale, 55.4 million in 2019. The 5th dangerous disease was trachea, bronchus, and lung cancers. Very dangerous. 1.7 million people died in 2015. This is 3% of the deaths worldwide. It's again increasing worldwide from 1.2 million to 1.7 million. And now, as I mentioned before, in 2015, study shows that 18 million new cases of lung cancer every year. 18 million new cases of lung cancer every year. And one of the biggest causes of lung cancer is smoking. Very, very dangerous. Here we are. Trachea, bronchus, and lung cancers can affect anybody, but most likely to affect those who have a history of smoking and tobacco use. So there we are. The jury is in. Very, very dangerous. Number 6, diabetes mellitus. There's 2 diabetes, diabetes mellitus and diabetes insipidus. Basically type 1 and type 2. Type 1 is where your body isn't producing insulin, autoimmune disease. Type 2 is when it's producing insulin but not as much as your body needs, or it's producing it but you have something called insulin resistant where it's not doing its job. 1.6 million people died from diabetes in 2015. The complications are phenomenal. Diabetic retinopathy, neuropathy, the nephropathy, kidneys, blindness, your limbs. So dangerous. Diabetes is very dangerous. And 2.8% of that 55.4 million people who died from diabetes related issues, and again it's increasing every year. May Allah keep us all safe. Again, the fasting diet, so good for diabetes, as it's good for all the other things I mentioned. Olive oil is phenomenally good. And then the nap, subhanallah, having a kailula. Number 7, Alzheimer's disease and other dementias. 1.5 million people died in 2015 from Alzheimer's. You may know somebody with Alzheimer's and you know how debilitating it is. May Allah keep us safe. Again, Monday, Thursday fasting, olive oil has so much benefit. I mentioned in another episode of this program how beneficial medium chain triglycerides are, like coconut oil, very, very effective. So again, anybody older than 65, it's a big risk factor. Family history of disease, genetics, Down syndrome, unhealthy lifestyle, head trauma, being lonely. So important to be with these elderly people. Number 8, dehydration due to diarrheal disease. 1.4 million people died, 2.5%. Very, very dangerous. And number 6, I'm just being very quick, you've got 50 seconds, is tuberculosis. 1.3 million deaths in 2015, 2.4% worldwide. And the 10th most dangerous disease is cirrhosis of the liver, which is going through the roof because the liver is the biggest detox organ we have in the body. Our food is so crazy. We had a report just on the 28th of August, a few days ago, that England is the leading country in Europe with ultra-processed foods. Our diet, 57% of it is made from ultra-processed foods. And the study tells us, which I have right in front of me here, that this 24% increase of dying from a heart disease related issue or stroke, our food. So number 10, liver health. May Allah Ta'ala keep us safe. Our time is finished. Jazakallah for listening. Until next week, Assalamu alaikum wa rahmatullahi wa barakatuh.